Hello everyone, welcome to my channel. Today's topic is cataract. We'll learn about cataract in this video. Let's get started. The word cataract is derived from Latin word cataracta, which means waterfall. Cataract is the condition of eye in which lens become opaque, resulting in cloudiness of vision. Lens become opaque, which is opposite of transparent, and because of that opacity, vision becomes cloudy. Vision becomes completely blurred. But that blurred vision develops slowly, gradually. It starts with mild symptoms which can be ignored at the beginning, but gradually it develops and it also may lead to blindness. Let's move further. This is a diagram for cataract. Patient suffering from cataract, the patient's eye look like this. All the features that are seen like cloudiness in the lens, discoloration of the sclera will be explained in the sign and symptoms. Cataract might vary from one person to another. As I said, there are no such noticeable symptoms at the beginning, but the symptoms gradually develop, so it varies. Characteristics of cataract varies from one person to another. In some person there are slight cloudiness, whereas in others there might be obstructive cloudiness at a very less time interval. Obstructive cloudiness might develop in some patients. During the development of age-related cataract, this is mostly found in old age people, old age groups. So during the development of age-related cataract, there are no specific signs and symptoms, but gradually symptoms like short-sightedness, yellowing of sclera, as we saw in the diagram, yellowing, discoloration of sclera, and opacification of lens might occur. Cataract progress slowly and it leads to vision loss. Incidence of cataract, incidence prevalence, it increases with aging and it is the leading cause of blindness in India. By the age of 80 years, nearly half of the population seem to be affected by cataract. Next is classification of cataract. Cataract can be classified into congenital and acquired. Let's move ahead with congenital cataract. Congenital cataract can further be divided into punctate cataract, zonular cataract, coronary cataract, and capsular cataract. They belong to the same category, still have their own specific characteristic feature. Like punctate cataract are manifested by small, multiple, opaque, scattered cloudiness. They are also known as blue dot cataract because the small scattered cloudiness appear as blue dots. Zonular cataract is caused because of deficiency of vitamin D in body. It is bilateral, can be caused in both eye at a time with strongly dominant hereditary character. So it is basically genetic. Coronary cataract commonly occurs at puberty. So not only old age people, also teenagers can be sufferers of cataract. Coronary cataract commonly occurs at puberty, situated in the deep layer of cortex. There are cortex layer, covering layer, where there are gap of club-shaped opacities in the cortex of the lens. In the cortex part only, this cataract develops. Next is capsular cataract. Capsule meaning is covering layer. Capsular cataract is caused because of delayed formation of chamber. Next is acquired cataract. Acquired cataract contains senile cataract, toxic cataract, systemic disease cataract, and cataract due to radiation. Also, traumatic cataract. Senile cataract occurs in old age group, especially age above 75 to 80 years. Toxic cataract can be caused because of various kind of drugs and toxic substances which are carcinogenic for humans. Drugs like corticosteroid, antimitotic drugs can cause toxic cataract. Systemic disease cataract. This is caused because of presence of systemic disease in the body like diabetes mellitus, hypothyroidism, and hypocalcemia, systemic disease cataract. Next is cataract due to radiation. Cataract can also be caused due to ionizing radiation like X-rays, gamma rays, beta rays, which can be cataractogenic and cause cataract. It causes cataract by affecting the germinal epithelium in the lens equator. In the equator of lens, it affects the germinal epithelium, growing epithelium. Traumatic cataract is caused by mechanical injury of penetrating type and also be associated with intraocular foreign body. So in traumatic cataract, it is basically caused by physical injury, mechanical injury, that also penetrating type of injury. And after the penetration, there are chances that foreign body and infectious organism might enter the eye. So traumatic cataract is characterized by mechanical injury, entry of intraocular foreign body. This was about types of cataract. Now pathophysiology, how cataract develops. First of all, causative factors like genetic, trauma, and toxic medicine, they enter the body and begin the process. After that, altered metabolic process with the lens. The metabolic process of body seems like quite disturbed with the lens. The blood supply, fluid supply, whatever is given to the lens seems like disturbed. Because of that, there is accumulation of fluid in the lens. After that, there is alteration in lens fiber structure, lens muscle structure. The muscle that holds the lens becomes altered and eye shape looks like it is changed than normal. That causes opacity of the lens and blurred vision, cloudiness of vision, any way you can explain it. Anyways, it causes opacity of the lens. That's how we call it cataract. Continuing with clinical features, initially there are no signs and symptoms that disturbs the daily activities. There might be some sort of blurred vision, but there are no noticeable clinical features in the beginning. Yes, but there is cloudiness in one part of the lens. But as time passes, signs and symptoms develop gradually and white pupil is seen. Also, reduced visual acuity. This can be found out by visual acuity test. Monoocular diplopia means one-sided eye can also give diplopia, double vision. Monoocular diplopia, one-eyed diplopia. There is alteration in separating colors. The person is not able to separate colors or recognize the colors properly. Okay, one color seem like another, one color seem like another. There is basically no recognition of colors. There is no pain, redness, or discharge from the eye, as there is no sign and symptoms which can be noticed. So there is no pain, no redness, or no discharge from the eye. If we remember the diagram in the beginning, there was also no redness and no discharge from the eye. There was discoloration and lens was opaque. Severely dense cataract causing severely impaired vision can cause a complete white pupil. This is about a severe phase of the cataract. If it is treated in the beginning phase, it is okay. If not treated, then severely dense cataract causing severely impaired vision can cause a complete white pupil. Investigation for cataract can be, first of all, history taking. History about occurrence of cataract in any generation. By making a family tree or genogram, we can find out who else in the family had cataract before this. After that, physical examination. Physical examination includes eye examination. This can be explained like this. Visual test can be performed. Visual test by using Snellen's chart or eye inspection of the eye. Which part is cloudy, which part of the lens is cloudy, which part is discolored. That can be found out through inspection. Next is visual field test and visual acuity test. We already have a video on both of this. Visual field test, the examiner occludes one eye and fixes the non-occluded eye and asks the patient to count any object or look at a diagram. This way, the examiner finds out that what is the extent of peripheral vision of the patient. In visual acuity test, This is eye's ability to detect fine details like right-sided, left-sided, up-sided, down-sided, fine details of anything, any letter, any picture, or anything. Management for cataract can be general management, surgical management, and nursing management. Before management, I want to go back to diagram. The diagram which was in the beginning. In this diagram, the sign and symptoms that we learned here, discoloration of this part, sclera, every cornea, sclera, and there is cloudiness of the lens. There is cloudiness of the lens. There is opacity of the lens, and because of dense cataract, there is slight change in the shape and size of the lens. Again, let's get back to management. Management can be divided into general management, surgical management, and nursing management. General management includes use of correction lenses first. Cataract might cause refractive errors, so use of corrected lens can help the patient to visualize anything properly, anything in the surrounding properly, visualize screen properly, everything. Cataract can alter the refractive power, so use of correction lenses can be done. Next is better lighting of surroundings. This is for comfortable vision. The person already has cataract, and if we don't provide comfortable vision surrounding, then patient can have more difficulty in vision. So there should be better lighting of the surroundings, bright enough lighting of the surroundings. Next is, this is a kind of medical management, but still included in general management. To delay the progress of cataract, as I said, cataract progresses slowly. So to delay the progress of cataract, some medicine like aspirin and antioxidants can be given. Antioxidants can be taken from dietary source, but oral aspirin can be taken 50 to 100 mg. Surgical management is phacoemulsification, extracapsular cataract extraction, and intracapsular cataract extraction. These three surgery. First of all, phacoemulsification. This is a technique of breaking the cloudy lens, breaking the cloudy part of the lens by using frequency vibration through a tiny insertion. A tiny insertion is made, and they use some fluidy particle to break the cloudy lens, and then the particle comes out of the eye. Next is extracapsular cataract extraction. In this surgical process, some or entire part of the cloudy lens is removed. First of all, 5 to 6 millimeter incision is made in the eye from the edge where cornea meets sclera. That means outer part, towards outer part. And then the lens is removed from that incision. After removing, intraocular lens implantation is performed. Because of this implantation, patient can again have a normal refractive vision. Intracapsular cataract extraction or surgery is not used as much as extracapsular, but still we should learn about this and also write an exam. This is a process of removing some part of the lens which are cloudy. That some part can be posterior capsules and zonules, but the remaining part of the lens still remain intact. Remaining part is not so much part, but the less part which is remaining, unaffected part, still can remain intact. What can nurse do for the management of cataract? Nurse can perform nursing care before the surgery, during and after the surgery. Before the surgery, it is a very common thing. Informed consent should be obtained. Patient and patient's family should be explained about the procedure. As this cataract can occur in old age patient, explaining to the family becomes even more important. After that, vital signs should be monitored and patients should be physically prepared in hospital gown. Parts should be prepared. You know, as a nurse, you should make sure that patient's hair is washed and face is washed. There should be no application of makeup or any kind of product before the surgery. Nurse should also arrange all the equipments needed for the surgery, that is preparation of nurse. Psychological support should be provided to the patient. The conjunctival sac, the surgery insertion is done through the conjunctiva and then sclera cornea. So conjunctival sac is prepared by using broad spectrum antibiotic 2 to 3 days prior to the surgery. Usually, this broad spectrum antibiotic is given intravenously. After this, intraocular pressure should be controlled. Intraocular pressure at a normal level. If that is increased, then surgery might be paused at that time because of raised intraocular pressure. So it should be controlled before the surgery. Next is pupils should be dilated for extracapsular surgery. Pupils should be relaxed, dilated so that it creates no problem during the surgery. Anticoagulant therapy should be started 1 week prior to the surgery. Anticoagulant like warfarin should be provided actually to reduce the risk of retrobulbar hemorrhage inside the retina. This retrobulbar hemorrhage can be a complication of ocular surgery. So anticoagulant therapy becomes a preventive management. During surgery, role of nurse is maintaining the position of patient. Also look after the need of the equipments of surgery. After the surgery, first of all, emergency care should be given. Priority is monitoring airway, monitoring pain intensity, consciousness, vital signs, and looking after any discharge from the incision site. After that, as soon as patient becomes stable, nurse should provide health education about how to protect the eye, when to take the medicine, oral medicine, and ointment, topical medicine. Also, recognizing the sign of complications like bleeding, complications like acute pain. If such complication occurs, patient should be immediately returned to hospital. Next is patient should be taught about the importance of follow-up, because in every follow-up, patient's visual acuity test and visual field test will be done, so that if the patient's refractive capacity is still disturbed, then patient will be generally managed with correction lens. So there is importance of follow-up, as this our whole topic is about vision, one of the most important function. Follow-up is very, very important. Thank you so much. Next topic will be explained in next video.